Welcome back to Life, Death, and Everything in Between. I'm Bob Sennett, owner of Sennett Funeral Home, and as always, I'm joined by my co-host, Brian Baker.
Hey everyone, today we're diving into a really important topic, hospice care. A lot of people don't fully understand what hospice is, what it does, or when it's the right time to consider it.
That's right. It's one of those things people don't want to think about until they have to, and by then, they're often overwhelmed. So we're bringing in a local professional to help clear things up. Joining us today is Shelby Bates, Hospice Community Representative with Care Initiatives Hospice. Care Initiatives has been around for years and have helped countless families navigate this difficult but important stage of life. Welcome to the podcast, Shelby.
Thank you for having me, Bob and Brian. I appreciate the opportunity to be able to talk about hospice and help educate people on what we get to do.
All right, let's start with the basics. A lot of people have misconceptions about hospice. Can you break it down for us? What exactly is hospice care?
Yeah, okay. So hospice care is about living life to the fullest. We're really about quality versus quantity. So while experiencing a life-threatening or a terminal illness, typically those doctors have recommended our services to our patients. So that often means that their life expectancy is 6 months to a year or less. We seek to make the individual comfortable, make their remaining time as meaningful as possible, and our team is filled with compassionate healthcare professionals that work together with patients and families.
I think some people assume that choosing hospice means giving up. That's not the case, is it?
Hospice is definitely not about giving up. It's really actually rather redefining your goals with the help of our interdisciplinary team. Quality of life is really at the center of what we do. So we bring together physical, emotional, and spiritual care support to whoever the patient calls home. So let's say that they are in their home, a nursing facility, an assisted living. We can serve our patients wherever they call home. Our goal is really to help patients and their loved ones redefine quality of life and live each day to their fullest. From coordinating an anniversary celebration to attending special events and even crossing off bucket list items.
One question we hear a lot is, how do I know when it's time to call hospice? What advice do you give families who are struggling with this decision? One thing I hear from my side of things as a funeral director is, mom or dad or our loved one was only in hospice for a day or two. We here know it's important to utilize these services much more than just the lasting days. Shelby, help explain this to our listeners.
Yeah, awesome question. So as I mentioned earlier, often the first indicators come from your family doctor or another physician. They are often the first one to see those signs. We call them indicators. But they're really defined indicators that we are and the healthcare professionals watch for. There are often signs and symptoms a loved one may observe too. So you've noticed a decline in mom and dad and cognitively, weight loss, falling. These can be a combination of things, recurring infections, wounds, sleeping more, overall decline, lack of progression in any area. If you think your loved one may be showing signs of these, it may be time to talk to their doctor. And we're always happy to have a discussion and answer questions as well.
So it's not just about the final days or weeks, but something that actually can help for months.
Absolutely. In fact, we often hear families say, I wish we had called hospice sooner. It's often about providing support earlier rather than later and making that difference. It's important to remember that hospice isn't just for the patient. We really are there to support the family through the beginning stages and the end transition of everything.
Our episode sponsor today is Shelby from Care Initiatives. Care Initiatives proudly serves more than 2,500 residents and patients through 43 skilled nursing locations, 2 assisted living locations, 7 independent living locations, and 8 hospice office locations. Based in West Des Moines, Care Initiatives is committed to improving the quality of life for residents, patients, and their families during life's health transition through compassionate, individualized care. To learn more, visit careinitiatives.org.
And for every episode, we are going to have a sponsor, so we truly appreciate having Care Initiatives be our sponsor for this episode. So now we're going to tackle some myths and misconceptions. One I hear a lot is that hospice means stopping all medical treatment. Is this true, Shelby?
No. Really and truthfully, this is about accepting hospice care. It does not mean that your loved one is stopping all medical treatment. Patients can continue to take medication for other conditions. Our focus really remains on quality of life and ensuring that that patient is comfortable during the time that they have left.
Another myth, hospice is only for cancer patients. What's the reality of that?
So hospice is for a variety of life-limiting illnesses, which does not disqualify cancer, obviously, but also for conditions such as COPD, CHF. Actually, the top diagnosis used in 2024 was Alzheimer's, and end-stage renal disease, neurological conditions such as ALS.
So another one I hear often is we can't afford hospice. So educate us on how that all works.
So most people who use hospice are over the age of 65 years old and are entitled to the Medicare hospice benefit. So this covers virtually all hospice services and requires little to any out-of-pocket cost. This would mean that there's no financial burden to the family.
Very good. If someone listening thinks their loved one might benefit from hospice, what's the first step?
So if you have questions, our team is always available 24 hours a day, 7 days a week, 365 days a year. When you think it may be time for hospice care, it's important to talk to your loved ones, their physician, and then get that referral made. They'll always look for indicators we talked about earlier and that getting that process started. So if you're seeing a decline in your loved one or you've noticed something's off, I would always recommend talking to your physician first.
Okay. And hospice isn't just for patients, it helps families too, right?
Yeah, exactly. Yep. So we do what we call respite care, and it's often overlooked by families and actually probably misunderstood. But what respite care means is that our team can provide short-term care in order to give that family member a break. So when they go home with hospice, you have to have a 24-hour care provider. The family becomes that 24-hour care provider, and it's a lot to take in. We provide respite stay. So that means that this can last for a few hours to a few weeks. So if they have to go on a vacation or a wedding that requires travel time away from the family member having hospice care, this is a good example of what we would do with respite stay. Under Medicare, 5 consecutive days of respite care may be covered under hospice. And in addition, we have spiritual care counselors who can offer grief support and emotional support. And hospice bereavement services are available for the family up to 13 months after the patient dies.
Okay. Shelby, my parents were involved in hospice, and from a personal standpoint, I don't know what we would have done without you guys. You guys were great with my parents and the family, and my sister, who did most of the work working with hospice, thanks you very much too.
I love that.
What if someone is in the hospital or facility and they are getting a hospice recommendation from that hospital or facility? Do they have to use that suggested hospice, or do they have options?
You absolutely have an option, and they should always offer those things. I encourage you to find the hospice team that best suits your needs and your goals for your loved one.
Okay. That's good to know, and that's good for our listeners. One thing I can say from a funeral home's perspective is hospice and funeral homes are kind of hand in hand. Yeah. Yes, because we're both kind of dealing with end-of-stage life, and I will say that having hospice involved, from my perspective, is there's nothing better, because when I see it, both ways, obviously. And when a family has the time to go through hospice, it almost starts their grieving process already. And when they transition to the funeral home side of it, it just seems like it makes that grieving process that much smoother. So, we could not be more happy to be involved with hospice, and that's for sure.
Yeah, I love that.
This has been such a helpful conversation, Shelby. Absolutely. So where can people learn more about hospice services in our area?
Okay, so you can visit us online at careinitiatives.org, or you can call us locally at 641-932-3488.
Shelby, we'd like to thank you so much for joining us today. This is a topic that touches everyone at some point, and we appreciate your insight.
All right, folks, that's it for today. If you found this episode helpful, subscribe to the podcast on Spotify or YouTube at Life, Death, and Everything in Between. Follow us on Twitter, Instagram, Facebook at Senate Funeral Home, and please share with all your friends. And remember,
Life's short, death's certain, and everything in between is worth talking about. See you next time.